Have you ever stopped and wondered if something as simple as what you eat for breakfast every day could quietly be changing your health right now without you even realizing it? Because what I'm about to tell you might surprise you. There's a good chance that a very common food, something many people believe is either incredibly healthy or dangerously harmful, could be affecting your blood sugar, your heart, and even how your body ages, in ways most people don't notice until much later. And if eggs are part of your daily routine, this is something you need to hear. Before we go any further, if you care about your health and want clear, honest medical insights like this, take a moment to like this video and subscribe. It helps more people learn what most never get told in time. Now, let's talk about eggs. I've seen this happen too many times in my practice. Patients come in thinking they're doing everything right. They're avoiding sugar, cutting back on junk food, and eating what they believe is a perfect breakfast, 4 eggs every single day. And on the surface, it sounds healthy. Eggs are packed with protein. They contain important vitamins. They keep you full longer. All of that is true. But here's where things become more complex, and where most people don't realize what's actually happening inside their body. When you eat eggs every day, especially in higher amounts like 4 daily, your body begins to adapt in subtle ways. Your metabolism, your cholesterol balance, and even your blood sugar response can shift, not always in the direction you expect. Some people feel more energetic. Others, without warning, begin to develop small changes, slightly higher cholesterol levels, unexpected fatigue, or even changes in how their body handles glucose. And the truth is, these changes don't always show symptoms right away. That's what makes this so important. Because by the time something feels off, your body may have already been adjusting for months or even years. Now, I'm not here to tell you that eggs are bad. In fact, for many people, they can be a valuable part of a balanced diet. But what matters, what truly matters, is understanding what happens when you go from occasionally eating eggs to making them a daily habit in larger amounts. Because the difference between support and strain on your body often comes down to frequency, quantity, and your individual health. And in the next few minutes, I'm going to walk you through exactly what changes may begin to happen, so you can recognize the signs early and make choices your future self will thank you for. What I'm about to tell you might surprise you, because it challenges something many people have believed for years. For a long time, eggs were blamed for raising cholesterol and harming heart health. Then, suddenly, the narrative shifted. Eggs became a superfood, something people were encouraged to eat daily without much concern. But the truth, as it often is in medicine, lives somewhere in the middle. You see, eggs contain cholesterol. That's a fact. And when you eat 4 eggs every day, you are introducing a significant amount of dietary cholesterol into your body. Now, here's where it gets interesting. Most people don't realize that your body also produces its own cholesterol, mainly in the liver. And for many individuals, when dietary cholesterol increases, the body compensates by producing less. But, and this is very important, not everyone responds the same way. I've seen this happen too many times. Some patients can eat eggs daily and their cholesterol levels remain stable. Others experience a noticeable rise in LDL cholesterol, the type often linked to heart disease. And the challenge is, you won't feel it happening. There's no pain, no obvious warning sign. Everything feels normal until a routine blood test reveals that something has shifted. This is especially important if you're over 40 or if you already have risk factors like high blood pressure, diabetes, or a family history of heart problems. Because in these cases, your body may be more sensitive to dietary cholesterol than you think. But here's another layer that most people completely overlook. It's not just about the eggs themselves, it's about how they're eaten. Are they fried in butter or oil, paired with processed meats, eaten alongside refined carbohydrates like white bread? because suddenly what seemed like a healthy habit can quietly become something that puts additional strain on your heart and metabolism. And this is where I want you to pause for a moment and think, not just about whether eggs are good or bad, but about how your overall pattern of eating might be influencing your long-term health. Because the body doesn't respond to single foods in isolation. It responds to patterns, to consistency, to what you do day after day. And when something becomes part of your daily routine, like eating 4 eggs every morning, it stops being a small choice. It becomes a long-term signal your body is constantly responding to. In the next part, I'm going to share something even fewer people talk about: how eating eggs daily may influence your blood sugar and insulin response in ways that are often misunderstood. Now, this is the part that most people don't expect. Because when you think about blood sugar, eggs don't usually come to mind. They're not sweet. They don't spike glucose the way sugary foods do. In fact, eggs contain almost no carbohydrates at all. So, naturally, many people assume they have no real impact on blood sugar. But what I'm about to tell you might surprise you. Your blood sugar is not only influenced by sugar itself, it's also shaped by how your body responds to protein, fat, and hormones like insulin. And when you eat 4 eggs every day, your body is receiving a concentrated dose of protein and fat consistently, day after day. For some people, this can be beneficial. Protein can help you feel full longer. It may reduce unnecessary snacking. It can even support more stable energy levels throughout the day. I've seen patients who replace high-sugar breakfasts with eggs and experience fewer energy crashes. They feel more in control of their hunger. Their cravings decrease. But here's the part that often goes unnoticed. In certain individuals, especially those with insulin resistance or early signs of diabetes, the body may respond differently. Instead of improving balance, a very high intake of protein and fat in one sitting can sometimes lead to a delayed blood sugar response. Not immediately after eating, but hours later. And because it's delayed, people rarely connect the dots. They think, I didn't eat anything sugary, so my blood sugar should be fine. But their body tells a different story. This is why I always tell my patients, it's not just what you eat, it's how your body processes it. If you already have concerns about blood sugar, or if you've noticed symptoms like fatigue after meals, increased thirst, or unexplained weight gain, this becomes especially important because your body may be giving you quiet signals that something isn't fully balanced. And when a single food becomes a daily habit, like eating 4 eggs every morning, those signals can become more consistent over time. Now, this doesn't mean eggs are harmful for blood sugar. In fact, when eaten in moderation and combined with fiber-rich foods like vegetables, they can support more stable glucose levels. But 4 eggs every single day, without variation, without balance, may not have the same effect for everyone. And this is where awareness becomes powerful. Because once you understand how your body might be responding, you can begin to make small adjustments that protect your long-term health without giving up the foods you enjoy. In the next part, we're going to explore something even more surprising: how this daily habit may influence your weight, your metabolism, and even how your body stores fat over time. Now let's talk about something many people are quietly concerned about: weight, metabolism, and how the body stores fat over time. Because this is where things can become a little confusing. On one hand, eggs are often recommended for weight management. They're high in protein, they help you feel full, and they can reduce the urge to snack between meals. I've seen this happen too many times. Someone replaces a sugary breakfast with eggs and begins to notice fewer cravings throughout the day. They feel more satisfied, more in control, and in many cases, this can support gradual, healthy weight loss. But here's what most people don't realize. When you start eating 4 eggs every single day, the effect on your body depends heavily on your overall lifestyle and how your metabolism responds over time. You see, protein is powerful. It helps preserve muscle, which is essential for a healthy metabolism. but excess calories, even from healthy foods, can still accumulate. And eggs, while nutritious, are not calorie-free. 4 eggs can add a significant amount of calories to your daily intake. If those calories aren't balanced with your body's needs, they don't simply disappear. Your body stores what it doesn't use. And sometimes, this happens so gradually that people don't notice until months later, when their clothes feel tighter or their energy feels lower than before. What I'm about to tell you might surprise you even more. Some people actually experience the opposite effect. Instead of gaining weight, they unknowingly undereat other nutrients when they rely too heavily on one food. They feel full from eggs, but miss out on fiber, complex carbohydrates, and essential plant-based nutrients. And over time, this imbalance can affect digestion, energy levels, and even hormone regulation. Because your metabolism doesn't just depend on protein, it depends on variety. It depends on how well your body receives a wide range of nutrients working together. This is why I often tell my patients, it's not about eliminating foods, it's about creating balance. Eggs can absolutely be part of a supportive, healthy routine. But when any single food becomes the center of your daily diet, especially in larger amounts, it can quietly shift that balance. And the body always responds to patterns. So if you've been eating 4 eggs every day, I want you to ask yourself something simple. How do you actually feel? Not just physically, but overall. Your energy, your digestion, your weight, your hunger patterns. Because those subtle changes are often the first clues your body gives you. And in the next part, we're going to look at something even deeper, how this daily habit may be affecting your heart in ways that aren't always obvious at first. Now, let's go a little deeper, into something that often stays hidden until it becomes serious, your heart. Because when people think about heart health, they usually focus on obvious things: chest pain, shortness of breath, fatigue. But what I'm about to tell you might surprise you. Heart changes often begin silently. Long before symptoms appear, your body may already be adapting to what you eat every single day. And when it comes to eating 4 eggs daily, this is where individual differences matter more than ever. You see, eggs contain nutrients that can actually support heart health, like high-quality protein, certain vitamins, and compounds that help your body function properly. For some people, this can be beneficial. But I've seen this happen too many times. Others experience something very different. When consumed in higher amounts over time, eggs can contribute to increased levels of LDL cholesterol in certain individuals. This is often called bad cholesterol, not because it's inherently bad, but because elevated levels are linked to a higher risk of plaque buildup in the arteries. And here's the part that concerns me the most. You won't feel your arteries narrowing. There's no immediate discomfort, no early alarm that clearly tells you something is changing. It happens quietly, slowly, until one day a routine checkup reveals elevated cholesterol levels. Or worse, an unexpected heart event brings everything into focus. This is why awareness matters so much, especially if you already have risk factors like high blood pressure, a sedentary lifestyle, or a family history of heart disease. Because in these situations, your body may be less forgiving when exposed to higher daily cholesterol intake. But again, this isn't about fear. It's about understanding context. How are your eggs prepared? Are they boiled or fried in excess oil? Are they part of a balanced plate with vegetables and fiber, or combined with processed foods that add additional strain? Because your heart doesn't respond to a single ingredient. It responds to patterns, your daily habits, your consistency, your choices over time. And here's something I always remind my patients. A food that supports one person's health may affect another person differently. That's why routine checkups, simple blood tests, and paying attention to your body's signals can make such a powerful difference. Because when you understand how your body is responding, you're no longer guessing. You're making informed decisions. And in the next part, we're going to uncover something even more subtle: how eating eggs every day may influence your liver, your digestion, and the way your body processes nutrients behind the scenes. Now let's talk about something most people rarely connect to their daily breakfast: your liver and your digestion. Because what I'm about to tell you might surprise you. Your liver is one of the hardest working organs in your body. It processes fats, helps regulate cholesterol, supports blood sugar balance, and plays a key role in detoxifying what you consume every single day. And when you eat 4 eggs daily, your liver is directly involved in handling that consistent intake of fats and cholesterol. For many people, this isn't a problem at all. In fact, eggs contain nutrients like choline, which may help support liver function and play a role in fat metabolism. This is one of the reasons eggs are often considered beneficial in moderation. But here's where things become more nuanced. When the intake becomes high and repetitive, like 4 eggs every day without much variation, your liver doesn't just process it once in a while. It processes it constantly. And in some individuals, especially those who already have underlying conditions like fatty liver or metabolic concerns, this consistent load can become something the body has to work harder to manage. I've seen patients who felt completely fine, no pain, no discomfort, yet their routine blood work showed early signs that their liver was under strain. Nothing dramatic, nothing alarming at first, just small changes that, over time, could develop into something more significant if the pattern continues. And then there's digestion. Eggs are generally easy to digest for most people, but not everyone responds the same way. Some individuals may experience subtle symptoms, like bloating, heaviness, or a feeling of sluggish digestion, especially when consuming larger amounts daily. And because these symptoms are mild, they're often ignored. People don't think, maybe it's the eggs. They assume it's stress, or age, or something else entirely. But your digestive system is constantly communicating with you, sometimes quietly, sometimes in ways that are easy to overlook. And when a single food becomes a daily habit, those small signals can become patterns. Now, this doesn't mean you need to eliminate eggs. Far from it. It means you need to listen to your body more closely, because your liver, your digestion, your metabolism, they're all connected. And when one area begins to feel slightly off, it often reflects something deeper happening beneath the surface. In the final part, I'm going to bring all of this together and help you understand what a safe, balanced approach to eating eggs really looks like, so you can make choices that support your health, not silently work against it. So, after everything we've talked about, you might be wondering something very simple. Should you stop eating eggs altogether? And the honest answer is no. Eggs are not the enemy. In fact, for many people, they can be a valuable part of a balanced, nourishing diet. They provide high-quality protein, important vitamins, and can help support satiety when used appropriately. But what most people don't realize is this: health is rarely about one single food. It's about patterns. It's about how often you eat something, how much you eat, and how it fits into your overall lifestyle. Because eating eggs occasionally is very different from eating 4 eggs every single day, without variation, without balance, and without paying attention to how your body responds. I've seen this happen too many times. People follow a routine because it feels healthy. It's simple. It's consistent. It gives them a sense of control. But over time, that same routine, if it lacks balance, can begin to work against them in subtle ways. What I'm about to tell you is something I share with every patient who asks me about eggs. For most healthy adults, eating eggs in moderation, such as 1 to 2 per day, can fit into a well-rounded diet. But when you start increasing that amount regularly, especially to 4 or more daily, it becomes more important to step back and look at the bigger picture. Are you including fiber-rich vegetables? Are you balancing your meals with whole grains, healthy fats, and other protein sources? Are you monitoring your cholesterol, your blood sugar, your overall health markers? Because your body is always responding to what you do consistently. And the goal is not perfection, it's awareness. It's making small, informed adjustments before small changes turn into bigger concerns. So if you enjoy eggs, keep enjoying them. But consider rotating your breakfast. Add variety. Include foods that support your heart, your digestion, and your long-term health. And most importantly, listen to your body. Because those quiet signals, your energy, your digestion, your lab results, they tell a story. A story that, if you pay attention early, gives you the power to protect your health for years to come. And that's something most people don't realize until much later.